Hello, I'm Margarita Pinton Perez, Community Partnership Leader at the Center for Research and Education on Violence Against Women and Children, CREVOC, at Western University. Welcome to today's webinar, Designing Trauma and Violence-Informed Policies, Training, and Response Plans to Address Intimate Partner Violence at Work. I'd like to begin with a land acknowledgement. I want to acknowledge that we are learning, speaking, and hosting this virtual event on the traditional lands of the Nishnawbek, Haudenosaunee, Lenampewak, and Chettington nations. These lands are connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. Today, this land continues to be home to many Indigenous people from across Turtle Island. We give our deep respect to the first inhabitants of this land and recognize that an acknowledgement of Indigenous land and sovereignty comes with the responsibility to understand the history and ongoing impacts of settler colonialism. These impacts continue to be felt in disproportionate and everyday ways against Indigenous communities. We also reflect on those who came to this land involuntarily, particularly those brought to these lands because of the transatlantic slave trade and slavery. We recognize that today, Indigenous communities face disproportionate forms of gender-based violence and a crisis of missing and murdered Indigenous women and girls and 2S LGBTQIA+ peoples. We recognize the responsibility for our work to be informed of the colonial imprint and harms that shape the experience of GBV among Indigenous communities, and we commit to furthering our work in ways that best uphold solidarity with Indigenous survivors and those supporting them. Today's webinar is part of our ongoing series led by the Learning Network and the Knowledge Hub here at the Center for Research and Education on Violence Against Women and Children. We also collaborate at times to expand our reach and strengthen our collective efforts. For today's session, we're pleased to have worked with a sister project at CREVOC, Respect at Work. I'll turn to my colleague Adri to introduce Respect at Work, and I'll follow with a brief introduction to the Learning Network and Knowledge Hub.
Hello, welcome everyone. I am Adriana Berlingeri, research partner, adjunct professor, and the lead of the Respect at Work area at the center. Our team works collaboratively with government agencies, unions, employers, workers, and other researchers and experts to conduct actionable research and develop evidence-based resources to prevent and address harassment and violence at work.
Thank you, Adri. I'll now just share a brief introduction to the Learning Network and the Knowledge Hub, which hosts this webinar series. The Learning Network, the LN, is a knowledge mobilization initiative funded by the Government Ontario that bridges the gap between current gender-based violence research, practice-based knowledge, and lived experience, strengthening the capacity of the GBV sector and movement. The Knowledge Hub facilitates a trauma and violence-informed community of practice for projects conducting intervention programming and research for people who've experienced violence funded by the Public Health Agency of Canada. To learn more about Respect at Work, Learning Network, and Knowledge Hub KH, please access the website links posted in the chat. And on behalf of all three projects, welcome to the webinar. Before we begin, I'm pleased to introduce the presenter for today's webinar, titled Designing Trauma and Violence-Informed Policies, Training, and Response Plans to Address Intimate Partner Violence at Work, presented by Rika Sawatsky. Rika is a workplace lawyer, trainer, investigator, and gender equity consultant based in Toronto. Rika's work bridges law, research, and practice to help organizations build safer, more inclusive workplaces that last. Her programs are grounded in trauma and violence-informed principles, adult learning theory, and evidence-based approaches to equity and inclusion. A biracial Japanese-Canadian feminist, Rika brings both legal insight and lived experience to every project. Her core services include inclusive workplace design, harassment and violence training and mitigation, investigations, parental leave administration, and gender audits. You can find her full bio and additional details in the link shared in the chat. Rika, we're so pleased to have you with us today. I'll now pass it over to you. And once the presentation is complete, Adri from Respect at Work will rejoin you to guide the Q&A session. Thank you.
Thank you so much, Margarita, and thank you so much for having me. It is such a pleasure to be here. And it's just so heartening to also hear that we might have hit possibly a record for the number of registrants, which is so wonderful, especially as we approach the end of the 16 days of activism against gender-based violence. This has been a mission of mine to make IPV programming a regular part of workplace health and safety programs. And I'm just so heartened to see that there's so much interest in the workplace community. A quick content warning. I know some of the subject matter is going to hit close to home for many of the people here today, so please take care and take any breaks that you may need as needed. I am going to skip past the reconciliation related slides because Margarita did an excellent overview of the legacy of colonization on the also on the impacts on the disproportionate rate of intimate partner violence that we see in our Indigenous communities today. So the focus for today's presentation, after I give a brief overview of what being trauma and violence informed is, I want to focus predominantly on a arbitration decision that came out in Ontario in 2017, in which an employer did not take a trauma and violence informed approach to supporting an employee who was being abused by her husband for 20 years at the time that she disclosed, and was also dealing with intersecting issues related to substance use disorders. And after taking you through the facts of that case and the decision, what I'd like to do is then go back and see how there might have been different opportunities in which the employer could have intervened had they taken a trauma and violence informed approach to things. And then before we go into the last 30 minutes or so of Q&A, we can do a quick recap of the takeaways for individual workplaces. So, what does it mean to be trauma and violence informed? I know that many of you, especially if you're coming from HR or LR, are familiar with the term trauma informed, which is very much a buzzword in the employment law world as well lately, especially in workplace investigations. But I really like the concept of trauma and violence informed practice that's being spearheaded by the healthcare sector for a couple reasons. One is that the concept of being trauma informed tends to focus on the individual's impact in the mind, whereas being trauma and violence informed also looks at the external factors and sources of violence. The other critique that I think is fair is that trauma is looking at the impact of past violence, whereas being trauma and violence informed recognizes that there tends to be ongoing and constant external sources of violence, which is going to equip employers to be better at supporting survivors in the workplace, as you'll see in today's presentation. Now, there are really four principles to being trauma and violence informed that I've shown on the screen here, and we'll be returning to these themes throughout today's presentation. The first one really is showing that you get it, so that you really understand not just the individual experience of violence, but also the external societal sources of that violence and the experience that the individual has with that. It's also creating a safe workplace. So that's where individuals feel safe enough to disclose that they might be experiencing domestic violence, safe enough for colleagues to check in. And then also the process of supporting the employees is safe as well. A third critical principle is that you create real choices for the survivor as they participate in whatever supportive process you're offering them. And the last one is that you're focusing on strengths, as opposed to a tendency societally, there's a tendency of either blaming the victim or approaching these kinds of supports as a charity. It's really shifting that to focusing on the strengths that the survivor has exhibited and then building on that to create a support plan in the workplace. Now, as we're applying a trauma and violence informed lens to things, I think there are three principles or concepts to keep in mind. The first one is that you don't ever have to be thinking, oh, does this employee need a TVI approach and does this employee not need it? Because in the healthcare sector, the overall approach is you should just assume that everybody can benefit from it. And there was an interesting statistic that Equip Healthcare shared that about 3/4 of Canadians have experienced some form of trauma in their lives. Of course, not necessarily or exclusively related to domestic violence, but it could be anything from a car accident to a traumatic emigration or immigration experience to Canada. So the point is that we live and breathe TBI as a universal approach to how we conduct any of these health and safety programs in the workplace. The second important one is you don't have to be an expert. And this is something I hear a lot as an employment lawyer from clients, where there's concern that you might be exposing your workplace to liability by verging into an area that's outside your wheelhouse. So on this subject, I think it's important to remember that being TBI doesn't mean that you are going to become the therapist or the counselor for the employee who's coming to you for support. It's just an approach that you apply to your existing HR or LR functions. It's how you interact with the employee, the manner in which you provide the supports, and the safe space that you create so that there's a level of trust on which you can build a plan, a safety plan going forward. And the last one is a bit of statistics here for you to show that this is actually impacting a material chunk of your workforce. So just a few weeks ago, Futures Without Violence and the Domestic Violence Hotline in the United States released a report based on a survey they conducted across the country. And they found that almost 80% of domestic violence survivors said that their work was negatively impacted by the abuse that they were going through. So let's do a bit of rough math here to put this into context. We've seen some statistics that say that on any given day, up to 10% of a workforce is dealing with or being subjected to abuse at home. So if we apply this 80% number to that, we're looking at roughly 8% of any workforce on any given day suffering the negative fallout of domestic violence. So this is a material figure, and taking a trauma and violence informed approach to supporting these individuals will have a material impact. All right, so let's move on to the case study that I want to focus on. This all occurred at a rural liquor store in Ontario between the years 2006 and 2009, but the decision itself, like I said earlier, came out much later in 2017. And the fact that it is rurally located is relevant to our analysis today. There were two sister stores in neighboring small towns here in Halton Hills and in Acton, Ontario. Now, I know many of you are joining from outside Ontario, so I'll zoom out a little bit and you can see where these towns are relative to the bigger metropolises. So we have the GTA to the east, and then Guelph is the next city over to the west. Now, as I take you through the facts of this case, I'm going to introduce you to the survivor named, well, I'm calling her Jane. Her real name is not Jane. This is not her real picture. But I've put up a number of facts about her, and I want you to notice how these facts come out as I tell the story to you, which is based on the decision. And I want you to notice how there might have been opportunities where this information could have been elicited much earlier in the timeline, in which case there might have been earlier opportunities for intervention as well. So she started working in 2004, and for about the first 2 years, there were no incidents at all. And then in September 2006, a colleague catches her drinking at the workplace and reports her directly to a store manager. And in that meeting with the manager, Jane discloses, yes, I've actually been abused by my husband for the last 20 years. It's ongoing. And sometimes I turn to alcohol as a coping mechanism, but I do not have a substance use disorder. And she was adamant about that. So that then led to an independent medical examination that the employer ordered for her to go to Toronto. And there as well, Jane told the doctor, no, I don't have a substance use disorder. I don't drink anymore. And so that in turn led to a recommendation that she get counseling only for the domestic violence. And that came together with an agreement between the union and the employer that she would be placed on a 1.5 year leave of absence to get that counseling support. Again, there was no substance use disorder related support in this case. Now, there's no check-ins while she's on leave. A couple of months after she comes back to work, those 2 months, it was pretty quiet. But then the incidents start building up. There were about, by my count, 47 separate incidents in the 1 year leading up to her ultimate termination in September 2009. And you can see the breakdown of the incidents here, with the biggest one being unexplained absences. Now, I say unexplained because that's how the employer labeled it. They were not satisfied with the medical proof that she provided, but based on the way the decision is written, it's pretty clear that those absences were related to her either being beaten or she was drinking alcohol, so she could not show up to work. And in every one of those 47 incidents, there's a noticeable pattern that occurred. So there's a trigger of either her not showing up to work or she shows up to work under the influence of alcohol, which in turn elicits this conditional response from the employer. And I say conditional because it's always an if. So they said, if you admit having a problem, Jane, and if you ask for our help, then sure, we'll accommodate you. Or if you ask us to create a safety plan for you, then yeah, we can create one for you. Now, not surprisingly, and especially for the service providers amongst the audience members, this will come as no surprise. Jane did not come forward and say, yes, I need help, or yes, I have a problem, quote unquote. And so removed it then from a human rights law analysis by saying, I don't have a problem. The employer then went down the road of discipline. So that's the pattern we see in every case here. I want to take you through 3 specific examples just to illustrate this. So earlier on, she was away from work after having been hit. And this is after she returns from her leave of absence. And the employer says, well, wait a second, Jane, like, aren't you supposed to be continuing those counseling sessions in Guelph? Why aren't you going there anymore? And then she says, well, actually, I haven't been able to keep going because I don't have a car. And I'm now working days at the liquor store. I'm also working nights at the Walmart to make ends meet because my husband isn't contributing to any of the bills. Oh, and also my mother has passed away and I am grieving. So the employer only finds out after the fact that there were all these barriers. And because she wasn't providing appropriate medical support for her absence, she was disciplined. Now, just to give some more context about how unrealistic it was to go to Guelph, and again, putting in context that the employer never even thought about this barrier here. This is what the public transportation looks like between her address on Mill Street. This is on the right side of the page, and the counseling clinic in Guelph on the left side of the page here. So you're looking at about 1 bus every hour or so and a round trip of around 2 hours. So imagine if she even missed one of the buses, that she'd have to wait another hour to get on another bus, not to mention the transportation time and also the time to attend the sessions. It's just not physically possible to squeeze that into a day shift and then a night shift at Walmart after the fact. It wasn't realistic. Another example was the husband had actually come to the workplace at one point and assaulted her in the workplace. They had to call the police. Restraining orders were put into place. Jane eventually said, okay, I'm planning on leaving him at this point. Now, this really should have been a trigger for the employer to be engaging in risk assessments and safety planning. But instead, what happened was the employer said, okay, Jane, if you want, we can transfer you to another location. And if you want, we can create a safety plan in case he shows up again. Now, again, like I mentioned with the previous pattern, Jane was not about to ask for any support, so none of these supports actually ended up coming through. Now, the last example is she shows up to work one day with a black eye. The manager sees that she clearly can't work and he sends her home. And then over the next 10 days, she keeps calling in every morning saying, I still can't see out of my eye. I'm not presentable. I don't feel well. Remember, the manager is a firsthand witness to seeing that this is a legitimate absence. But because she wasn't producing doctor's notes in accordance with the absence management policy, the employer decided to discipline her for not complying with the absence management policy. Now, all of these 47 incidents lead to a clear pattern of progressive discipline, and any of you working in the LR/HR world can see exactly where this is leading. The employer is clearly gearing up for a just cause termination, especially with 6 suspensions at the very end of the line here. Now, right before her dismissal, one of the incidents where, again, she was caught drinking at the workplace, Jane finally, quote unquote, owns up to having a substance use disorder and asks for the employer's help. And so the employer says, okay, great, Jane, we're glad that you've come around and you're willing to talk about this. So here's what you got to do. In the next 2.5 weeks, you have to find a healthcare provider that's going to provide you treatment for your substance use disorder. And you also have to tell us exactly when you're going to be enrolling in those treatment sessions. The store did provide a recommendation, surprise, surprise, in Guelph, the next city over, which is, you'll remember from that best schedule, isn't very accessible. There was a 1-month inpatient program that they recommended. And if you take a look at their website, it says that the wait time to get in is usually up to several weeks. So already this is putting into context for you how realistic this was for Jane to satisfy that last chance. Now, leading up to the termination, you'll have seen in this pattern so far, it was Jane either being absent or drinking at work, and then the employer's response. But there were a couple of incidents where Jane actually proactively tried to reach out to the employer herself. And we'll dig into the relevance of this later on, but I just want to take you through the facts first. One instance was she didn't show up to work on July 14th all day. And then at around 4 o'clock in the afternoon, shows up in her uniform, comes to the store manager's office. He's on the phone and she's sitting, clearly waiting to talk to him. A few minutes go by, the store manager doesn't hang up the phone. And so she gets up in a huff, says, I'm not waiting anymore, I'm leaving. Now, those of you who work in the healthcare or service provider world probably can recognize this as a fairly common response, especially amongst vulnerable patients or clients that you work with. The second incident where she tried reaching out was actually after she blew past that deadline to prove that she's enrolled in a treatment program. The employer hadn't yet pulled the trigger on a termination yet at that point. But Jane had tried to contact the district manager for the district that she works in, and the district manager wasn't available. The assistant refused to take a message. But the district manager eventually did hear about the phone call. Now, here you can see evidence of the district manager just being at the end of her rope. She's frustrated with Jane, not seeing any progress. From her point of view, this is a troublesome employee. And so the district manager can't call Jane back. She just can't deal with it. And she contacts the union rep instead. The union rep isn't able to get a hold of Jane. And so in the district manager's view, that was it. That was the end of the line. And so they went forward with a just cause termination. Jane lost her job. Now, during cross-examination by the employer, and also in the decision itself, we can see that it was at the hearing for the first time that Jane explains why going to Guelph for that treatment program wasn't a viable option. So, I mean, first of all, we know that she didn't have a car. It turns out that she also had 5 pets at home whom she couldn't afford to board while she was in the inpatient program. Remember, she was also working nights to try to make ends meet, and she'd have to give up that other source of income if she were to do this. And repeatedly in cross-examination, she was asked well, why didn't you disclose all these barriers that you're having? Why didn't you ask about alternatives? Why didn't you ask for an extension? Now, the employer's position in this case, clearly not trauma or violence informed. Their position in this was that this has nothing to do with human rights at all. It doesn't really ultimately have to do with domestic violence. This is strictly a just cause termination case. So I'll take a moment to do a bit of an aside because there's some legal explanation required here because this is a labor relations setting. There was progressive discipline throughout getting to the point of termination, and the union never grieved any of those warnings or suspensions. And by the time that this went forward to a hearing for termination, the only issue before the arbitrator was whether there was just cause for termination because she didn't comply with the absence management policy and she breached the requirement to be fit for duty. Those were the only issues that were legally before the arbitrator. And so these considerations around substance use disorder and also domestic violence got relegated to a much smaller issue of whether there were mitigating factors that supported reinstatement. There wasn't at all a question of whether the employer actually satisfied its duty to accommodate under human rights law, for example. So with that legal explanation aside, the employer's position was pretty harsh. So they said, first of all, she hasn't proved that she actually has a substance use disorder or that she's suffering any kind of physical ramifications of the abuse or that there's a link with her performance at work. They also blamed her for not leaving her husband by saying that you haven't gotten rid of the cause of all of your problems, so you shouldn't be reinstated. And lastly, you haven't gotten support for your substance use disorder. You never took advantage of EAP that we offered. All you've done is go to a local church group to talk about the difficulties that you're experiencing. So you haven't mitigated and you can't be reinstated. Now, the arbitrator also clearly doesn't have a trauma or violence informed lens to apply to domestic violence in the workplace. So you can see here that he doesn't understand why Jane is consistently denying that she has a substance use disorder. And he says, well, if you're not going to own up to it, then the employer clearly doesn't have to go any further in trying to support you because that was your fault. A corollary to that is that every time the employer said, hey, if you ask for help, we'll support you, but Jane never took them up on that. So what was the employer supposed to do here? Now, Jane's response in every one of these cases, and again, some of your service providers, you'll recognize this kind of the way that she's responding here, saying that she doesn't realize or she doesn't recognize who she was back then, or her mind wasn't working back then. That was all that Jane could really say for herself in the testimony. So that's the overview of the case, and I want to take a moment here to pause and have you reflect on whether you think that Jane's cooperating, as the term is used in human rights law, really was realistic for Jane. Was it realistic for her to be getting support from the employer based on the way that they presented options to her? And how might a TVI approach actually have changed the outcome? So before we get into applying the TVI concept specifically to Jane's case, I want to take you through some of the legwork that the employer, the liquor store, ideally would have done in advance, because being able to provide a trauma and violence informed support to your employees requires a lot of that legwork where you're creating the foundation and the cultural safety for the employee to eventually come forward and seek your support at that point. So again, remember there are these 4 concepts here. I don't have time to go into each of these at any material depth, but I want to take you through some high-level concepts under each of these in order to establish that foundation on which trauma and violence informed support might have been provided to Jane. So let's start with that first principle here, which is about proving that you actually get it. You as an employer, are you showing to your employees that you understand what domestic violence is and how it impacts your employees? And implicit in this reference to policies, by the way, is actually making the policies known, because as an employment lawyer, I know a lot of your policies never see the light of day, which is not a critique, it's just a reality of many workplaces. So of course, when we talk about having IPV-related policies, the implication is that you're also making those policies known to your employees. Now, I want to walk you through 6 different concepts that I think are really critical for employers to grasp and understand in order to tick off this knowledge principle of IPV support. The first one is really understanding how prevalent it is in the workplace. So in Crevoc's own research, they found several years ago that it was about 6.5% of any given workplace on any given day is a survivor, is dealing with abuse at home. Now, I have seen corresponding numbers out of the UK and the US that actually puts the number higher, as high as 10.3%. The second thing that to really grasp is how to define IPV. We have a tendency to focus a lot on the physical ramifications of IPV. Jane, in her case, she was physically beaten quite a bit, but it's important for employers to recognize that sometimes IPV has no physical manifestations, or it is intermittent. And then that's when you hear this concept of the cycle of violence, where there might be bursts of physical abuse. But it's important to remember that in between those physical events, or if there is no physical violence at all, there's usually some form of constant violence that a survivor is dealing with, whether that be through the form of coercive control or harassment at the workplace or financial abuse or digital abuse, for example. Related to that is being able to recognize the lethal risk factors. So some of the more serious risk factors for domestic violence. And this is critical for employers to grasp because this is when you really have to start engaging in the risk assessments and safety planning, which health and safety legislation requires employers to do regardless of the survivor's actual participation. Another main thing to take away here is notice how many of these risk factors don't actually have anything to do with physical violence. A lot of this has to do with the relationship status or the state of mind or the circumstances of the perpetrator themselves. In Jane's case, the way the decision is written, we can at least pick up on 3 of these risk factors, but there might have been more. It's important to remember that this decision wasn't written with a TBI lens or looking at the risk factors that Jane was specifically going through. But again, the employer in this case, had they been trauma and violence informed, could have picked up on some of the more serious risk factors that were presenting in Jane's case, and that could have engendered some earlier action, catching the issues further upstream. The 5th concept I want to talk about is structural violence. And many of you might have seen this diagram here in some permutation or another. Sometimes there's more concentric circles, and it's referred to as the ecological or socio-ecological framework of violence. And within this, especially at the societal level, is embedded this concept of structural violence. The whole point of this is to be taking the focus away from the individual as the source and cause of violence and looking at the external factors that are leading to the violence that that person is experiencing. So let me walk you through some specific examples that pertain specifically to Jane. We have some research coming out of actually the Learning Network itself from a few years back that took a look at risk factors for rural and northern communities and also older women who are living in those communities. And so we know that the rates of violence are already much higher for them compared to urban communities. But for older women in these communities, there also tends to be, although not necessarily, but tends to be greater rates of self-blame and secrecy, as well as adherence to traditional gender roles, which leads to greater isolation, in addition to the geographical isolation that is already inherent to living in a rural community. We also saw in Jane's case that there was a lack of access to resources in her community, so that's why she kept getting referred to Guelph. And then also this concept of limited employment. Now, in Jane's case, after she lost her job, she wasn't able to find a new job after that. And we know from decades of research that having gainful employment and your own income stream is a critical lifeline and the best way to increase your chances of ever leaving an abusive relationship. And so the relative lack of employment opportunities in these communities makes it that much harder to get support and eventually, if they choose to leave. Now, another related concept is this concept of leaving. I have heard from some employers that they ask, well, why doesn't the employee just leave? But we have to have a bit of a mindset shift here. The goal can't be to get the employee to leave. It's to support the employee in what choice they make. And this is critical for a couple reasons. One is that it, on average, takes about 7 attempts to leave a partner before you can successfully and finally leave that person. And the second is that we saw from those lethal risk factors a few pages back that leaving can be a seriously dangerous endeavor for an employee. It is one of the highest risk factors for a domestic homicide. Now, lastly, in terms of health impacts, now we saw the employer taking a pretty strong position at the hearing, saying that Jane hasn't provided medical proof to support the interaction between the health impacts and the domestic violence that she was experiencing. But that is a legal position to take at a hearing. When we're talking about supporting an employee further upstream, we don't need to be demanding that proof as a condition of supporting the employees. A TVI approach would already assume that there are possible interactions and intersecting needs for support before the employee even comes to you. It's again, you're not assuming that that particular individual is dealing with all these things, but you don't want to be putting the burden of proving the need for support on the employee at the outset. It's really going to be wearing down that foundation of trust that you need. And if you don't have the trust, then you have more resistance and you have more wasted time and lost opportunities. Now, when you look at it in this sense, I think Jane's comment that her mind wasn't working back then and that she was a different person makes a lot of sense because she was dealing with a lot of these physical consequences of assaults, especially to her head, and then also the related substance use disorder that she was using as a coping mechanism at the time. Now let's move on to this concept, the second principle now of creating cultural safety in your workplace. Now, when we talk about cultural safety at work, there's four themes here. I'm talking about safety for the employee to disclose, also safety for colleagues to check in with their coworkers that they notice might be dealing with domestic violence. It's safety for managers to do the work themselves, and then safety in how the manager interacts with the survivor and providing that support. So the first one is about creating safety for the disclosure in the first place. Now, the fear of retaliation is legitimate and it's very real. That report that I mentioned came out a few weeks ago out of the US, found that anywhere from 60 to 65% of employees dealt with negative consequences after disclosing IPV at work. Not surprisingly, and unfortunately, with a disproportionate impact for Black and Latinx employees. So we need to be overcoming this fear of retaliation if an employee is ever going to feel safe enough to come forward. I've also been a big champion of trying to push for the IPV equivalent of the Bell Let's Talk campaign, because we need to get to a point where there isn't shame and stigma attached to it that is driving a lot of the silence right now. We need to normalize talking about it, just like how the Bell Let's Talk campaign had normalized talking about mental health issues in the workplace. And I mean, of course, the Let's Talk campaign isn't perfect. We still have a long ways to go, but I think many of you can reflect on how it has changed the way we talk about mental health issues and how we proactively provide supports for that in the workplace. I mean, some workplaces are even built with enough accessibility and flexibility that individual accommodations don't always even have to be requested. It would be so great if we could get to that stage when it comes to IPV at work. This other picture I've posted here is something I took when I was on vacation in Sardinia in Italy this past summer. And I noticed these posters were everywhere in museums, in shops, convenience stores. And it was an island-wide campaign that was advertising a hotline for victims of violence and stalking. And this kind of communication campaign, where you can put posters up in your elevators, in your washroom stalls, this is something that can accompany email blasts and talking about it in your meetings. It is basically the equivalent of the Bell Let's Talk campaign that any individual employer can do without waiting for your district or a telecommunications company to do it for you. Another thing that's important to remember when creating safety for disclosure is you want to keep the survivor apprised of what to expect if they decide to come forward so that they can make an informed decision. Because remember, a major part of of IPV is that you get a lot of control taken away from you. You don't have agency. So you don't want to be perpetuating that in your own support processes. So make it clear up front how you're going to be protecting their confidentiality, that they don't have to worry about judgment from the employer because you really get it. And you also understand how certain health considerations intersect, and that the survivor will have an active role in deciding how the safety plan is going to be created for them. So let's move on to the second concept of safety, which is for the colleagues to check in with each other. You'll remember Jane's colleague reported her directly to their manager for drinking at work. Now, of course, that is such a challenging thing to approach an employee or a colleague directly about. But if we think back to the fact that there was a period of 2 years where there were no incidents at work, that might have been an opportunity for a colleague to check in earlier, because I am willing to bet a lot that there were other signs of Jane dealing with domestic violence during that 2-year period that her colleagues would have seen. So we have, for example, this was again from Krivak's own research, that one of the most prominent ways in which IPV shows up to work is with via abusive phone calls or text messages. So that might have been something her colleagues might have witnessed. But then, of course, there's also physical signs too, like employees who stay at the workplace outside of their actual working hours, or sudden, unexplained, but repeated absences, covering up when it's warm out. Those are a variety of signs that employees could be taught to keep an eye out for so that they can recognize the IPV, after which they can also be trained on how to check in with their colleagues. Now, again, there's just not enough time to go in through all the details of this, but it's important that we remember to train our colleagues on checking in. And one option for doing that is Krivak's own Sync It method, which can be as simple as saying, "Hey, Jane, I've been noticing you're getting a lot of phone calls from somebody, and you seem to be having to really work on calming them down every time. And I'm worried about you. Would you feel comfortable talking to me about it?" Now, of course, it's up to Jane or the survivor in that point on how to respond. And it could very well be that that first conversation doesn't go anywhere. But that is not a sign of failure. The fact that that conversation was started and that you've opened the door means that there are future opportunities for that conversation to continue. And there's a very good chance, I'm willing to bet, that in that 2-year period where Jane wasn't exhibiting signs of substance use disorder or domestic violence at work, that had a colleague checked in, there might have been opportunities to get help and support much earlier on. Now let's talk about whether it's safe for managers to do the work. This is something that I don't think actually gets enough attention, because we're often talking about supporting the employees. But let's talk about the reality that it is hard work for managers. So let's go back to that district manager who was just burnt out and couldn't deal with Jane anymore. I mean, sure, some of us, it could be easy for us to judge her and say, well, how could you have no sympathy? But the reality is that she has a very busy job. And she's also seeing Jane, who, from her perspective, probably comes across as a difficult employee. And so in order to provide TVI support for our employees, we have to make sure that our own managers and HR professionals are also getting the support that they need to be able to do an effective job at that. And there are a number of recommendations, again, coming out of the healthcare sector that's leading the charge on team-based TVI. But most of it has to do with the fact that you have a group, and certainly at least a buddy with whom you can work with. So in the district manager's case, it would have been ideal if there was one other person who was apprised of Jane's case and could swap with the district manager when that district manager was feeling burnout. If she was feeling vicarious trauma and couldn't deal anymore, then this other person could have stepped in and called Jane back after that missed phone call to continue the conversation. Having these opportunities for debriefs to share missed opportunities, lessons learned, any kind of barriers that might have been identified for the accommodation process. These are all critical to having an effective TVI approach to your health and safety programming. And lastly, of course, you want to make sure that there are adequate supports for the managers, whether that be through EAP or making sure your group benefits cover appropriate counseling programming. All right, now the last one is, do you reinforce safety in the process itself? So this is where the manager and the employee are now actually engaging with each other. And a lot of this has to do with the manager just being able to check in with themselves to see where their mindset is at. And are they in a position to be supporting the employee with a trauma and violence informed lens? So again, going back to the last page, if you're in a headspace where it's just not happening today, then ideally you'd have a colleague who could tap in, tap out at that point in time. And it's again shifting this attitude away from, well, what's wrong with Jane? Like, what is her problem? To looking at that broader ecological model of all the things that are feeding into why Jane is presenting the way that she is in the workplace. Now, I'm going to shift a little bit into some legal discussions here for human rights accommodations, because this is, of course, a key part of the HRLR rule, and it is also a gray area when it comes to IPV in the workplace. Now, as a starting point, I want to highlight the fact that the employer in this case really focused on supporting the substance use disorder as a potential human rights issue, but the domestic violence issue as a question of culpable absenteeism, effectively. And so one was possibly accommodation, the other was discipline. And we have lots of research in the healthcare world showing that treating these separately as two different silos has no impact. They have to be dealt with together, which then leads into the question of, do we deal with domestic violence as a human rights consideration at all under human rights law? So, as I mentioned, this is a bit of a gray area in Canada, and we have the United States as a juxtaposition. So, in some states in the US, they actually have explicitly in their legislation that being a domestic violence survivor is a protected ground of discrimination. And then separately, the EEOC has also recognized a link between sex discrimination and domestic violence survivorship. Now, let's contrast that to what we have in Canada, where we don't have a single human rights commission that has said anything about this. And we also don't have any case law that has actually commented on this with a final decision on the merits. But I will say, I have been advising clients to treat it as a human rights issue because we might be heading down the road of getting confirmation that it is subsumed under sex or marital status. So we've had now decades of, human rights hearings where nothing is happening in terms of the intersection of IPV and employment law. And just this past year in 2025, there were 3 cases that came forward. One of them was tossed for being out of time, but the other 2 are making their way through various interim motions. One of them is at the federal level, and the other one is at the BC Human Rights Tribunal. And I thought that the interim decision out of BC was particularly interesting. So I've included a couple of quotes here because at the interim decision, they're already recognizing the potential for and laying the groundwork for a finding that IPV can be subsumed in the ground of sex. They made a similar comment in terms of marital status. And the last thing, this is more of an employment standards consideration, is that there is research showing that many employees aren't actually aware of the availability of domestic violence leave or the fact that it is paid. And even though this research, for instance, in 2022 came out several years after that new legislative provision was introduced in Ontario. So we need to be doing more to just even talk about the availability of leave. We have to tell these employees that this is available. And again, it's telling them what to anticipate if they decide to come forward, creating that cultural safety. Now let's move on to fostering real choices. Remember how Jane really going to Guelph wasn't an option here, but the challenge that the employer ran into is that Jane wasn't voluntarily disclosing the barriers that she was facing. So part of being trauma and violence informed when you're dealing with survivors in the workplace is that you have more of a duty to inquire here. You're going to have to ask about potential barriers as opposed to waiting for the survivor to tell you what they are. So if you have a potential option for an accommodation, walk through it with them and say, hey, let's go through this and see if there might be any barriers for you that come up along the way. And if there's anything that we can do to mitigate that or come up with another solution altogether. I apologize for the formatting here. We were dealing with some font transcribing earlier today. The Other thing, especially for rural communities, is it's so important for employers to be plugged into your local community and to know what the resources are that are available for you. So, for example, some shelters take a zero tolerance approach towards substance use in the workplace, which means somebody like Jane would not have been able to secure a bed there because she was using alcohol as a coping mechanism. So knowing if there are resources that take more of a harm reduction approach would be helpful for you in providing referrals to your employee. Similarly, for inpatient programs, like I mentioned before, many more are taking a multidisciplinary approach. And so they're weaving together support for both substance use disorders and domestic violence, as opposed to treating them as siloed issues. The last one being strengths-based, shifting away from a charity or victim blaming approach to taking a look at how much strength they've already exhibited in surviving for that long. I mean, Jane has lived for over 20 years with her husband abusing her. That takes a lot of survival skills and also probably a lot of management skills in trying to manage her husband in the situation. So even just calling out that strength and affirming it and telling her that she has exhibited all that strength can go a long way in building that foundational trust. And then finding a safety plan that fits into the routine that she has established is much more effective rather than asking her to disrupt her life, disrupt her routine, drop everything, and go to the next city over to get some treatment. All right, so now that we have laid this foundation for the liquor store, let's say that they had all this laid out already. Now let's go back through the facts of the case and see how things might have been different for Jane here. Now, these are the key events that happened in the timeline here. And I asked you earlier when I was talking about the facts to see if there might have been missed opportunities along the way. Now, let's talk about that first 2-year period where there was actually no incident at all. What do you think would have happened if the policies in the workplace actually showed Jane that, yes, this store gets it? They talk about IPV. They understand how it intersects with substance use disorders. They understand and prove that it's not Jane's fault, that she will have confidentiality and no judgment if she decides to come forward. If all of these were laid out and actually shown to Jane and the other colleagues, I think there's a good chance that she might have felt safe enough to come forward and seek the store's support much earlier on during that 2-year period when she wasn't even turning to alcohol for support. But let's say that Jane wasn't feeling comfortable enough herself to come through. Might there have been enough cultural safety for the colleagues to check in with her? Now, again, remember, they had decided to report her to the manager when they saw her drinking in the workplace. But that's 2 years after she started. I'm certain that they would have seen signs of IPV in that 2-year period where it might have been an easier conversation to have to check in with her. And even if that first conversation didn't go anywhere, it might have opened the door for eventually talking to the colleague and perhaps going to management and getting support later on. Now let's go on to the date of the actual disclosure. So remember, this was the day on which she was reported for drinking alcohol in the workplace. Now, do you think that things might have been different if the store said, well, do you have a substance use disorder? Because if you don't, then we're just going to refer you to counseling the next town over for IPV. Now, instead of that, what if they had opened a conversation about exploring how the turning to alcohol was intertwined with the domestic violence issue? Maybe that would have led to an intervention on both prongs as an intersecting accommodation, as opposed to relying on Jane's denial that she doesn't have a substance use disorder, and then focusing only on IPV counseling in Guelph. Another question is safety planning. Remember, there was no safety planning that had occurred at this point, but really under health and safety legislation, once you have that initial disclosure of domestic violence, it's so important for employers to be engaging in a safety plan at that juncture. It's not just for the individual employee like Jane, it's also for other employees, because you'll recall that later on, the husband actually showed up in the workplace and there was an assault in the workplace, at which point there was no safety plan at all, even though the employer had been put on notice much earlier that Jane had an abusive partner at home. Now let's move on to the period of the leave of absence while she was away. Now, the way the decision is written, there was actually no checking in by the employer during this period of time. But what if the employer had in fact checked in with her to figure out if continuing these sessions in Guelph was even going to be viable after she returns to work from leave? Maybe they would have found out at that point that their plan wasn't going to make sense. There were too many barriers. And so they could revisit the safety plan and other accommodations and supports so that she can continue getting the help that she needs. Now let's go back to the post-return to work period where there was a couple months where there were no events, and then you'll recall that all of a sudden these 47 incidents, there was a great escalation in incidents that happened. Now, what if at that point they realized, okay, clearly there are a lot of barriers here that we haven't accounted for, and they proactively went to her and said, Jane, let's talk about this. We need to revisit this, and we're here to support you. And another corollary to this is even though Jane kept saying, no, I'm fine, I don't need this, it's important to remember under health and safety legislation that the employee's participation actually is totally irrelevant under legislation. Once they're aware of a risk of physical domestic violence, the employer has a duty to take every precaution reasonable in the circumstances for protecting that employee and the other employees in the workplace. And so if the employer had presented it that way to Jane and said, listen, we understand if you're not prepared to participate right now, but we'll leave the door open for you to participate when you're ready. And by the way, here's what you can expect in the meantime about what we'll be doing. That keeps that door open for her to continue participating when she feels ready. Now, in the lead up to that missed deadline, again, there were further escalations. What if instead of the store disciplining her for not providing, for example, those medical notes to explain why she was gone for 10 days after she went home with a black eye? What if they recognized, okay, no, she's clearly absent for legitimate reasons. And in fact, instead of disciplining her, there is escalating danger here, which is a significant risk factor. This is another opportunity for conducting another risk assessment and a revised safety plan. Now let's go back to those last two attempts of Jane proactively trying to reach out to the employer. Remember that phone call where she came in and sat down and then left in a huff from the manager's perspective? We have to remember that in this case, from Jane's perspective, she's coming from a household where her husband is chipping away at her self-esteem and her autonomy, her agency. And then from Jane's perspective, she also has an employer who doesn't understand what's going on. From Jane's perspective, she probably thought, I couldn't even come into work today, but I managed to bring myself to the office to have a conversation with my manager. I did it at the end of the day, and they couldn't even acknowledge me. And so that's why she got up and left. Now, of course, I'm imputing a little bit here, but I am also drawing from stories from the healthcare sector where service providers work with vulnerable individuals and have seen this kind of behavior of ostensible impatience when really they are behaving in what makes the most sense to them in the moment. So what if the manager if they couldn't hang up the phone call, at least acknowledge Jane and said, Jane, I know it took a lot for you to come in here today. Please give me a moment to finish this phone call and we can pick it up in a few minutes. That might have actually changed things. She might have stayed in the office longer and continued the conversation. And as with the district manager, remember that tap out protocol that I talked about. The district manager never ended up calling Jane back and went straight to firing her. But what if the district manager had a colleague or a buddy who was apprised of Jane's situation, and the manager could call that friend and say, I just can't do this right now. Can you please take over? Jane called. We missed a call from her. She needs to talk about something. Again, at that point, there might have been an opportunity to discuss with Jane what her needs were. So these are all the questions that come to mind for me when I look back at this case from a trauma and violence informed lens. And I ask you now if you think the outcome might have been different for Jane if any of these missed opportunities could have been caught earlier. So just to do a quick recap of what this means for employers in the workplace, again, the theme for today is focusing strictly on policies, training, and response programs. For your policies, the main questions really are about showing that you actually get it And then also communicating to your employees that you get it. So these policies have to be known to your employees. On the training side, you want to be focusing on training both the employees so that survivors can see that you get it and colleagues feel safe about checking in with each other. And let's not forget about training our managers so that they feel safe in providing the services to these employees. Because let's face it, it can be very exhausting and traumatizing work for the people who are providing these supports as well. And also knowing when to distinguish between disciplinary approach and an accommodation approach, bearing in mind the gray legal area that we're at here in Canada. Now, lastly, in terms of response plans, this is where the principles of fostering real choice and strengths-based solutions come into play. Really focus on how you can build on that to support the employee rather than the blame or the charity approach. Now, I want to take a bit of a macro view here of where these tips reside in the bigger IPV health and safety program. I mean, the reality is that this is just a part of an ideal IPV program. It's not the whole picture. And I hesitated a little bit on whether to put this slide in because I was worried that it would give the impression that you have to have a whole ton of resources that you have to throw at this thing. And some people might think, okay, this is not realistic for our workplace. And that is not at all the message that I want you to take away here. I think on one hand, I mean, the trauma and violence informed approach really is an ongoing learning process and also something that the team is continuing to build on and turn it into a second nature, something that you live and breathe in all facets of your workplace. And there are also a lot of resources that are available to you, including free ones that I've included on the resource sheet that was distributed through the presentation materials. And I think if there was going to be one takeaway, it really is going back to that Bell Let's Talk thing, just starting to talk about this in the workplace so that we can start chipping away at that stigma that is silencing people and making them feel fear about disclosing and getting help in the workplace. If that was one place, if there's one place that we could start, that is what I would recommend, is just start opening the conversation and normalize talking about it so that people don't feel so isolated at work. And I think the fact that many of you have shown up today to come here is already such a heartening thing for me. And it's a great first step in that direction. I'll share, I know we're a little over time, but I'll just share a quick anecdote. About 7 years ago, when I was still an associate on Bay Street, I tried to give our corporate clients a presentation on domestic violence in the workplace. And I had a few partners come and tell me that none of their clients want to hear this, that it's going to hurt their practices and their reputations, that no company wants to be told how they should be dealing with the personal lives of their employees. And I am so glad to see the turnout at today's presentation to prove that they are so wrong about that, that clearly there is an investment and interest in amongst workplaces to be supporting survivors in the workplace. And it really is just such a heartening thing to see. It's so wonderful and also such a great way to wrap up these 16 days of activism against gender-based violence. So thank you for being here and thank you for your interest and thank you for having me. So we can move on to the Q&A section now.
Thank you so much, Rika. Now let's, as Rika mentioned, move on to the Q&A. We encourage you to continue submitting your questions as we try to get to as many questions as possible, and we'll do our very best to do that. I do. Before we do that, Rika, I want to just thank you. I'm so glad you did add that big picture, the big picture slide. We often refer to it as a journey. Start somewhere. That's what you mentioned at the end of your presentation as well. And it's something that workplaces should really be aspiring to. And so start where you can. And what I always say is learn along the way. It's a complex issue. And you've shared some really concrete ways to move forward and also concrete ways to increase safety, and really importantly, trust that also happens over time as well. So thanks very much for that. Okay, let's get to some of the questions here. Um, so a person is asking, can you elaborate more on leave of absence for IPV? And is it through EI? Is the question.
Yes, so it varies from jurisdiction to jurisdiction. In Ontario, for example, you have 5 days of paid leave followed by uh, 10, I think it's 10 weeks. I cannot remember exactly off the top of my head, but of unpaid days. Now, this is strictly an employment standards based leave. So it's required by legislation. Now, to answer your question about whether EI might cover it, as far as I'm aware, there isn't an EI benefit specifically for IPV, but I think that a nexus could be made to the EI disability benefits, especially if some of those intersecting issues are present. For example, they might be really dealing with concussion fallouts or PTSD, if you can get a diagnosis on that, substance use disorders for sure. So if you have a disability related intersection, then you can probably take advantage of EI benefits there, but there is no standalone EI benefit for IPV.
Thank you for that. And you did mention, Rika, in your presentation that a lot of employees don't know about DV leave, and
That's
we're
right.
hearing that through our research as well.
Yeah.
There is some information on the Learning Network website on DV leave. We also have one on, it's not part of the job, an actual map, depending on where you are in Canada on DV leave, both paid and unpaid as well. So thank you for that.
Yeah,
Yeah.
well, that 2022 report that I included a quote from, and it was almost kind of heartbreaking because so many of the survey
Mhm.
respondents said, "Oh, if only we could have had paid leave, that would have made such a big difference for me because I couldn't afford to take time off, but I so needed to do, X, Y, Z, like I needed to move house at the last minute." When it turned out that they actually did have paid leave available to them, they just didn't know. And so this is all part of those four principles of being TBI, right? Is educating showing to your workforce that you understand it and also telling them what all the various supports are. Go ahead, Adri, you were going to go to the next one.
Yeah, no, I actually just want to say, and also increase the trust that you were talking about as well,
Yes.
right? When an employee is informed of their rights within the workplace as well. So
Hmm.
those are all ways that trust can be built over time as well. So thank you for that. Someone is asking, do you have an example of a policy in terms of supporting an employee experiencing gender-based violence? I think you did mention a lot of the parts of policies that are really important in this, and also the concrete components that have to be a part of it.
Yes. Yeah. So you know what? There's actually a free policy builder at Crevac's own dvatwork.ca website.
Yeah.
But I would add just a couple of words of caution. One is that policy is built for the federal jurisdiction. So you will need a lawyer to incorporate some changes to match whatever jurisdiction you're in and the related health and safety as well as employment standards laws. But the other thing is that I think it's so important that you need to have a tailored policy for it to really make sense in your workplace. Boilerplate really just isn't going to cut it. So using this policy at dvatwork.ca is a great foundation, but you should really do the work to put in the procedures of how it will play out in your workplace. So if you are a bigger organization, for example, that has, a security department, groundskeeping department, separate IT, separate payroll, all these departments, the reality is that somebody from each of those should be involved in your IPV programming because they're all going to have a role to play. Possibly, they might have to act in the moment. So your policy and programming should have already figured out who the different players are in your particular workplace and establishing what their individual roles are. So again, dvatwork.ca is a great starting point, but I would really, really recommend that you do some work to tailor that to your particular workplace, either just through do it with your own HR department or get external counsel support.
Yeah. And Rika, you point to something really important is the process of creating a policy that's unique for your workplace, right? Or
Mhm.
customized for your workplace is a learning process in itself.
It
You
is,
need to,
yes.
right? You need to ask all those questions that you have shared with us throughout your presentation. So it's a really great exercise for workplaces to go through. This is a question I get a lot. Someone is asking, what do you do? Like, what do you do if your employer is aware of intimate partner violence, of that an employee may be experiencing, but fails to take any action?
So this is what does the employee do, I guess, is the question
Yes,
from their
yeah, I think so.
perspective.
Yeah.
I mean, you know, if it would be easier if they were unionized, for instance. A lot of unions, I think, are doing a great job of leading the charge and leading the conversation on IPV in the workplace. So if they have a union rep, I think going through them and trying to put some pressure on the union to put pressure on the employer, that would be ideal. But if we're dealing with a non-unionized workplace, I mean, it's so frustrating. I think there are a couple of legal avenues you could take. Now, one is, as I said, the human rights angle is still a bit of a gray area. So, you know, even if you were to bring a human rights application, it might not go anywhere. There's also the reality that there's such a huge backlog of about 2 years. So by the time you even get a hearing, it's going to be too late. I think the other option is, let's say that the employer's inaction is creating so much hardship for you as an employee, then you might consider possibly a constructive dismissal angle where you could say that the employer has made it untenable for you to continue working there because they're not protecting you. And then maybe the last angle, which doesn't bring too much benefit to the employee, but could ultimately benefit other employees in the workforce, is to submit an anonymous complaint to the Ministry of Labor. And they will usually send somebody in to see if you're complying with those workplace violence policy and program requirements. I do know that the Ministry of Labor does actually do something about that. There was, in fact, a case a guilty plea that was entered just a couple last week, I think, and the employer had to pay a fine at a restaurant for having insufficient workplace violence policies. And this, I think, is an important lesson for a lot of employers, actually. So the policy had a general generic line like call the supervisor if a violent person shows up. But the Ministry of Labor said that's not good enough. You actually have to have like radios or in direct messaging. It's not enough to say you can message somebody on Slack in the moment. So I know that this is an area that the Ministry of Labor is taking more seriously. Of course, submitting that complaint to the Ministry of Labor might not really benefit that employee in the moment, but would hopefully, you know, trigger some action on the part of the employer. Even if it's just a warning from the Ministry of Labor, that might get the employer to take it more seriously and take action at that point.
Yeah, that's a good point. It's really around taking action and becoming more aware as a workplace.
Mm-hmm.
Yeah. I think one of the things that you pointed at throughout is the complexity of this issue, right?
Yes.
And that workplaces need to do the background work on that as well. So thank you for that.
Yeah.
So someone is asking, one leadership struggle I had was a VAW organization policy
Mm-hmm.
that said if a staff member was charged with a crime, that I would need to terminate employment due to work with vulnerable
Yeah.
populations. In reality, a staff member was accused of domestic assault during the workday by the spouse she was leaving. So we kind of see sometimes like how it's
Mm-hmm.
working, right, in the workplace. As she was at work, it was an impossible situation, but police pressed charges anyway. It got
Mm-hmm.
thrown out in court, obviously, in brackets, the person says. How do we
Mm-hmm.
navigate the nuances of the weaponization of IPV and mandatory charging in police to practice through a DVI way in spaces that serve vulnerable populations? So it's really, I think, about, navigating those nuances between, I think, the weaponization of IPV and mandatory charging is the question that they're asking in practice.
Yeah. So am I understanding correctly that it's an employee who was the abuser?
No, it sounds, well, it could be, it doesn't say. In reality, a staff member was accused of domestic assault during the
Right.
workday by the spouse she was leaving. It's not clear, but
Oh, and so that wasn't
She,
substantiated. I see. So it's a false
yeah.
accusation. Is that what she's saying? Oh,
Yes, yes.
okay. Okay, that is a really tough one. I think,
Mhm.
okay, first I should say that this question does verge into criminal law questions, and I'm not a criminal law expert, so I can't really be commenting on the interplay with mandatory arrest policies. So I do apologize about that. I am coming at this as an employment lawyer. But it does raise a couple concerns for me. I think, first of all, um, we have to be very careful about false allegations about IPV. I think that they are very rare, and we should default to assuming that a survivor who's coming forward and seeking an employer's support is doing so in good faith, because it'll be clear quickly, pretty quickly after you start going through the motions of supporting them, whether it's a legitimate need or not. But it is because there is so much stigma around reporting, disclosing domestic violence. It's like sexual violence too. There's so much stigma around it that the rates of false accusations are so incredibly low. And I think if we start taking a look at this as questioning or presuming that these might be a false complaint, that you're already going to be putting the survivor on the back foot. They're not going to have any trust in the process. And like I said before, without trust, you're going to have resistance, you're going to have wasted time, wasted opportunities. So I think as a first comment, I would say, it's just so unfortunate about the weaponization in this particular case and the fallout for the employee. It's horrible. But as a broader lesson to take away, I would caution employers to be careful about not taking these cases as a lesson to be learned, or to presume that there might be false accusations going forward. Now, in terms of dealing with employees who are also perpetrators themselves, and again, this is not directly answering the question because I don't have criminal law expertise, but I do have comments from an employment law perspective. I think it is so important to remember that, yes, you might generally have a policy for workplace violence to say we go straight to just cause termination because we have a zero tolerance approach to violence in the workplace. That, of course, is a standard approach. But when you make these decisions, I think it's important to remember that IPV has some very unique nuances. One is that if you fire the abuser, that the abuse at home is going to get so much worse as a result of that job loss. And also, you're taking away some of the income for that household. And so the survivor will also be dealing with economic hardship as a result. Now, this doesn't mean that you therefore never fire the individual, but what I would encourage employers to do is to take a step back, especially if you're unionized, to also discuss with the union if there might be other workarounds to holding the individual accountable without actually causing more harm at home. Because if your ultimate goal is to be supporting the survivor, you have to think about the harm that you're causing by firing. So, there might be options for last chance agreements, particularly in unionized workplaces, referrals to outside sources of counseling that specialize in IPV. And I think that's a whole other discussion, but they are not all created equal. Some are really great at dealing with the societal causes of violence, whereas I think others take a more narrow approach and focus on anger management, for example, which is proven to be not effective in cases of IPV. But in any case, these are examples of alternatives to holding the individual accountable without going straight to a termination, which I think is a critical consideration before you decide what steps to take when you're dealing with IPV at work. So I apologize to the person who asked the question because I just don't have the criminal law expertise to address the interplay with mandatory arrest policies, but you did raise some important nuances for employers to consider when it comes to dealing with employees who are not the survivors, but actually the person doing harm. Because an effective IPV program will also account for how to support those employees as well.
Thank you for that. That's in a really, it's kind of a gap, right, in the
Mhm.
legislation across the country and in other countries as well around. But the reality is that we do have perpetrators in our workplaces,
Yep.
and so we need to consider that in our practices and in our policies as well. I
Mhm.
just want to make a comment around the dbatwork.ca website.
Yes.
You may find it's down temporarily. We are actually creating a new site, and we're bringing together all of the DB at work historically, all of the research that we've done, all of the tools, and we're bringing them onto one site. But we'll take a look also at least leaving it up temporarily. Thank you, Rika. It is a really helpful website. So just
Yeah,
know that we
okay,
are
great.
always doing things at the center and fixing things and doing, just taking it to the next step to make it a worthwhile experience
Yeah,
also for anyone who goes onto one of our websites as well.
yeah,
So thank you.
fantastic.
I think we have some more time. This is a question that's interesting as well. How much disclosure is appropriate by a supervisor to other employees, HR, et cetera? And this is
Mhm.
important. I think you were talking about really, one thing I wrote down was that it's a collective effort, right?
Yep.
Especially we saw in this case, right? It's a
Mhm.
that you shared with us. So the person is asking, can you give some examples of how IPV is communicated in a workplace where an employee is experiencing IPV?
Yeah, great question. And this also goes back to that bigger picture slide that I showed, where you might have noticed that there is like an interdisciplinary team line item
Yes.
on
Yeah.
that page as well. And so okay, so I think there's a couple of concepts to this. One, I'll just deal with the more finite legal concept, which is in health and safety legislation. There is a privacy provision that says that if you're going to be alerting members of the workforce about a person who's a potential threat, that you limit that disclosure as much as possible. So to whatever extent is necessary for the protection of employees, but no more beyond that. So that could be, for example, relevant for receptionists, for instance, who might be at the entrance. And if they are required to be screening for individuals coming in, it's probably not a good idea to have a wall of pictures of individuals that they're screening. Setting aside the privacy concern, there's also the concern of what kind of blowback the survivor is going to get when they get home. And the partner says, why was my face up on the wall? But that is an example where you have to get creative around how are you going to make sure that receptionists or security people who are supposed to be screening can do so discreetly. But let's answer the question outside of the legal limitations then of how do you practically limit the flow of information. And this is where a lot of that upfront planning before an employee even comes forward is so critical. So when you have the interdisciplinary team, ideally it would be somebody representing all the major departments who would ever have a role to play in the event of a report. So I mentioned before groundskeeping, for example. Well, that's because stalking at the workplace is a common form of DV showing up at the workplace. So those individuals need to know what to keep an eye out for. And if they notice suspicious activity, they need to know who they then report to. Likewise, for IT, this is an example where I think, especially with rising digital abuse rates and also harassing phone calls happening at the workplace, that IT needs to know how to neutralize those threats that are coming into the workplace in the moment. So there are various department heads who should at least always be in the know of any kind of domestic violence threat or report that comes in. And then this is where this concept of a decision tree comes into play. And that is how you're going to limit the flow of information to, whatever is the most required in the moment, because you don't want to end up in a situation, and I've heard this happening, where a report of domestic violence comes in because you have this great policy, and then the person who gets it in HR is like, oh no, I don't know what to do. And then they start asking this person and this manager and that director, and they keep asking multiple people to figure out where it has to go. I think that is the example of what you don't want to do. What you do want to have is a decision tree already in place so that regardless of where the report comes in, so if you are a direct manager, you already know that you're supposed to report it directly to this particular person in HR. Or if you are a groundskeeper person and you saw suspicious activity, you already know that you have to go to this person in security who will then chase it up the line. And then vice versa too. Once the safety plan has been created internally at the HR level, there should be a reverse decision tree of who gets to be in the know about enforcing that safety plan in the workplace. And so it'll depend, of course, on how big your organization is, what departments you have, how you're structured. I mean, are there places where people are working alone? It'll really vary, but the idea, there isn't really like a there's not just one right answer on how much information to disclose. It's more about being deliberate about you controlling the flow of the information. So you know who should be in the know and who needs to know after you learn about IPV at any different point in the workplace.
Wow, that's a really great distinction. Thank you. Like,
I
because we get
think,
that question a lot too. So thank you for making that so very clear
yeah.
for that question. I think we may be done with timing. So there are lots of questions. Unfortunately, we could not get to. So I think we'll just pass it on to Margarita.
Thank you so much. So thank you so much. There were lots of questions. Unfortunately, that is all the time that we have today. Before we sign off, I just want to take a moment for some closing remarks and a few brief announcements. So firstly, thank you so much to our presenter, Rika Swatsky. Thank you so much, and to the Respect at Work team for collaborating on this webinar. Thank you also to our ASL interpreters, Rogue and Carmel, and our French interpreters, Sylvie and Wendy. A special thank you to the Learning Network, to the Knowledge Hub, and the Respect at Work teams who are busy behind the scenes coordinating. And we're just going to put up a few slides just to share some brief announcements. So before we close, um, just wanted to share a brief announcement from the Respect at Work team. They are currently inviting workers across Canada to participate in a national survey on experiences of harassment and violence at work. If you're 18 or older and have been employed at any point in the last 2 years, you're eligible to participate. The survey is voluntary, confidential, and anonymous, and it takes approximately 10 to 15 minutes to complete. Please note that the survey closes today. With sharing just our next slide, I also want to invite you to the Learning Network's 2026 virtual forum, which will bring together practitioners, researchers, and advocates to explore how artificial intelligence is both contributing to gender-based violence and reshaping practices across the GBV and allied sectors. So you can register for the virtual forum through the link in the chat. And just our final slide here. The LN would also like to invite you to share your insights on how AI is showing up across GBV prevention, response, and service delivery, including your awareness or experiences addressing AI-enabled forms of GBV. You can learn more and access the survey as well through the link in the chat. So thank you once again for joining us today. This is our final LNKH webinar of 2025, and we're grateful to have shared this space with you throughout the year. We'll resume our webinar series on February 17th, and we look forward to announcing more details soon. So wishing you a wonderful holiday season, and we look forward to welcoming you back in 2026. Thank you, everyone.